Hello, my name is Leticia Salas, and today I'm going to talk about how to conduct a proper venipuncture procedure, which is also known as drawing blood. So, what is phlebotomy and why is it important? Phlebotomy is the process of drawing blood from the vein in an arm. Phlebotomy is going to be important because it is used to diagnose patients. Phlebotomy makes up about 80% of the diagnosis process. If we didn't have phlebotomy, we would be guessing most of the time. So what you're going to need for your procedure is a patient, tourniquet, labels, pens to label your labels, gloves, alcohol wipes, your needle hub, your correct tubes that have been ordered, it says on the labels, gauze, Band-Aid or Coban, a sharps bin, and a trash can. So step 1 is identifying the patient that you are drawing. You are going to need to sit the patient down and ask for his or her first and last name and of course their date of birth. Once you do that, you compare what they say to the labels that were given for them, and once you're done with that and you make sure that everything's correct, you can move on to the next step. Step 2, you're going to put on your gloves, tie the tourniquet around your patient's arm, and feel for veins. So you're going to apply your gloves and then choose whichever arm you'd like to draw out of. Sometimes it is better to ask the patients if they have a preferred arm and go from there. Once you start feeling around, you want to feel with your pointer finger because it doesn't have any type of pulse because it could get confusing, and the vein should feel bouncy. So step 3 is cleaning your desired area that you would like to stick with the alcohol pad, and you like to let this area air dry. Once you let it air dry, you can start to gather your materials for the actual stick. Step 4 is going to be assembling my needle and my needle hub and putting the tubes and gauze within reach for the stick. I need to assemble my needle to my hub because they're two separate pieces and place that and all the supplies I need within reach for me. If I am drawing with my right hand, I want everything to be on my left side because my right hand is going to be in the patient. Just in case I need an extra tube or I need to reach for gauze, I'm able to grab it from my left side, and everything else is going to be within reach for me. Step 5 is going to be sticking our patient and placing the tubes we need into the needle hub. Once our area is dry, we are going to stick our patient with our needle. We are going to place the desired tubes into the needle hub and let them fill. If we have multiple tubes, then we're going to do that we're going to wait for each tube to fill, and then we're going to replace it with the next one. We do this until we are done filling the desired tubes that we need. Step 6 is removing our needle, placing gauze and pressure on our area, and snapping on the needle safety. This needs to happen in one motion, all of that, removing the needle, snapping the safety, and placing gauze and pressure on the area. You have to ask the patient to then continue holding pressure on the gauze, and you need to take the needle to the sharps safety bin immediately. Next is bandaging up our patient and labeling their tubes. You're going to use Band-Aid or Coban to help cover the gauze to stop the bleeding. We need to have the patient leave it on for at least 20 minutes after the procedure, so you're going to ask them to do that. We need to label each of the labels with our given tech codes and the current time. After that, you ask the patient to verify their name and date of birth in the labels, and then you will place them on the correct tubes when you're done doing that. And step 8 is dismissing our patient and cleaning up the area. After you're done with all the previous steps, you make sure your patient isn't feeling ill, and then you can let them go. If they're feeling ill, you offer a juice or you offer to sit there for a while they get over the nauseous feeling that they may feel. You can then throw your trash and take your tubes to the correct area where they're supposed to go when you're done. This is going to be the end of the presentation. I hope you were able to take away what goes down when you're conducting a procedure. If you're interested in becoming a phlebotomist, I recommend some training and maybe some classes. Other than that, good luck with your procedures, regardless if you're drawing or if you're getting drawn.